Do you know someone who is quietly changing their community for the better?
It's time to bring them into the spotlight. Join us for the 15th annual AMEC Congressional Global Champions Gala. This isn't just an event, it's a celebration of the legends living among us. Experience a red carpet walk, mesmerizing entertainment, recognition, and a program packed with action and cultural brilliance. Visit the link in our bio or scan the QR code to reserve your complimentary seat. Let's celebrate our heroes together. Let's meet on July 25th, 2026, 3:30 p.m. at Yellow Box, 1635 Emerson Lane, Naperville, Illinois.
Hello and welcome to Dr. VGP Talk Show.
தெக்கணமும் மதிசிறந்த திராவிடனர் இதனாடும் தக்க சிறு பிறை முதலும் தரிசனரும் கிழக்கும் அத்திலக வாசன் போலும் இன்பமுற எத்திசையும் புகழ் வணக்க இருந்த பெரும் தமிழனங்கே உன் சீரிடமை திறமியந்து செயற்பதந்த வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
This will be a solemn occasion like that. This is the first Prof. Kalyanaraman Oration. Without the blessings, the blessings of that, I request all of you to stand up in memory of silence and memory of Prof. I welcome you all for this Prof. Kalyanaraman Oration to be delivered by your distinguished orator, MMC alumnus of Madras Institute of Neurology, Prof. K. Selvakumar. I welcome our Dean, K. Shantaraman sir, who is to rush to the Secretariat and join us shortly. I welcome our Vice Principal, Dr. Srividya Madam, and our Medical Superintendent in charge, Dr. Sudhakar, Director, Institute of Neurology, and friend, Professor Mukundan sir. And I take great pleasure in welcoming distinguished guests of the day, Apurva A.S. Madam, who has taken the time to be present with us, and Dr. Vijay Prabhakar, distinguished alumnus of our Madras Medical College and the President of Multi-Ethnic Physicians Society of the United States of America. Welcome you, both of you, Madam. I also welcome Dr. Udayraj, friend of our distinguished orator, Dr. K. Selvakumar, all directors, professors, associate professors, assistant professors, dear students on the electrophysiology, physiotherapy, everyone. So without taking much time, I welcome all of you for this Professor Kalyanaraman Oration. Thank you.
Good morning to all of you, dignitaries on the dais, off the dais. I feel very much honored to be in this our teacher, legendary neurosurgery professor, the first PhD in India in neurosurgery, Professor Kalyanaraman Oration. On behalf of the Institute of Neurosurgery, I bid the program grants. And I welcome Prof. Kumar, today's orator of Kalyanaraman Oration. Thank you very much, sir.
Dr. Rajiv, sir, President of Multi-Ethnic Physician Association of United States of America, to this occasion. I request our director to felicitate our guest for the short.
Good morning, everybody. It's great to be back at Madras Medical College, where we learned our ABCs of medicine today. And today, to honor a great hero, Professor Kalyanaraman Neurosurgeon, who we all looked up to, is indeed a distinguished privilege. We like to congratulate Professor Rajiv, and the little interaction which I have with him is a dynamic historian and full of, he's a walking encyclopedia of MMC's history and the hospital. And I think the Institute of Neurosurgery has got a great director who was followed, and we know Dr. Ramurthy was one of the earliest directors, and I'm sure we're all proud of you, Professor Rajiv, and we give you a big round of applause. And I'm sure the Institute, under your directorship and leadership, will go to higher laurels. Of course, to talk about my college mate, Professor Selvakumar, is delivering the oration address today. He's an eminent neurosurgeon. He was the first MBBS graduate in the history of Tamil Nadu, and I guess India, to get directly admitted to MCH neurosurgery. That itself was a fact, a big achievement in the whole history of Tamil Nadu, and we were all envious of him. When we finished his MBBS, he directly went to MCH. That's a big thing if you know how the postgraduate approach. And he is now a renowned neurosurgeon. He set up the neurosurgical unit at Sri Ramachandra University, and he is an eminent domain specialist, expert internationally on telemedicine. He was the president of the Telemedicine Society of India in 2017, where he had got the attention of President Pranab Mukherjee then of India to put telemedicine on the India's health agenda. I wish this event all success, and thank you, Professor Raghavendra, and continued success to you and your team. Thank you.
Good morning, everybody. I came here as an audience to listen to what is happening, but then they asked me to sit. So this is the first lecture of Professor Kalyanaraman Oration, where Dr. Selvakumar is speaking. So I wish all the very best for the event and hope you love it. Thank you. Thank you, ma'am. Respected Medical Superintendent Dr. Sudhakar, Director of Neurosurgery Dr. Raghavendra, Director of Neuromedicine Dr. Mohandan, the orator of the day, the star, Professor Dr. Selvakumar, someone who has come all the way from United States to be a part of this program, Dr. Vijay Prabhakar, and as a friend of both of them, Mrs. Apurva ma'am, whom I know, I have worked with her, so it was a very pleasant surprise to see her today. And the faculty of MMC, Neurosurgery Department, postgraduates, students, a very warm good morning to one and all. It's always a pleasure to be a part of any program, but when it comes to oration, it adds a little more happiness and pride, because Madras Medical College, with its very strong legacy, has had very eminent personalities heading the various departments which are now called as institutes. So that when I come here, when I hear about either the oration or whose name it is, or the orator, it always gives me a lot of inspiration as to what has gone into the making of this great institution. I want every young person who is here as a part of the gathering to know and be proud of our legacy and emulate this, and in future, in a few more years, you should be the ones to be here on the stage as an orator, and many more such orations and programs should happen. So when I heard that Professor Dr. S. Kalyanaraman was the first PhD in this Institute of India, when Sir said, that is really awesome, because even now, doing a PhD in a medical profession is not that sought after. People hesitate to do research, though we call a lot of material and work is there. So at those times, when the need was not there, it shows his passion for how to do a research and how to disseminate the information. So that is again a very strong point to take note of by my younger colleagues. And Professor Selvakumar, thank you very much for taking through this topic. Telehealth is something which has been there for years, but then now with the advent of lots of what shall we say, artificial, with all the AI and everything, now telehealth has gone to a space above where many more things can be done. And with health for all as our basic requirement, as doctors, we want to deliver the maximum. And telehealth is something which is going to give us lot of interventions for people who are absolutely inaccessible. Not only that, in developing countries like us, it gives a boon to have interconnect with people abroad who are abreast with the latest procedures and other things. So I'm very eager to hear, sir, as to how he is going to help us in going through that. So thank you very much. Happy learning.
I request Vice Principal Professor Srividya Madam and MS in charge Professor Sudhakar sir and Director of Institute of Neurosurgery Professor Raghavendra sir to felicitate our orator Dr. Selvakumar sir with shawl, garland, memento and certificate.
Colleagues and friends, a very good morning to you all. Professor S. Kalyanaraman was born on the New Year's Day of 1934 in Tiruchirappalli. He finished his schooling in Trichy, passing out with flying colors in both his SSLC and intermediate examinations. He did his MBBS from Gandhi Medical College, again passing out as the best outgoing student in Madras University in Stanley Medical College. He did his MS General Surgery in Stanley Medical College, followed by FRCS in England and Edinburgh in 1961. He did his PhD in neurosurgery in 1964. As our VP Madam said, he is the first neurosurgeon not only from India but also from Britain to be awarded PhD in neurosurgery. In fact, he was the senior post PhD scholar in neurosurgery. He was one of the earliest PhD scholars in stereotactic neurosurgery. He finished his MS neurosurgery from Madras Medical College in 1965, once again passing out as the best outgoing student. After his MS in neurosurgery, he further trained in neurosurgery under Professor F. J. Gillingham and Professor Norman Dutt, and of course under Professor B. Ramamurthy. He organized the first head injury unit in India in the Government General Hospital, Madras, along with Professor B. Ramamurthy in 1966. He was the Professor of Neurosurgery, Madras Institute of Neurology, Madras Medical College from 1968 to 1991. During the latter part of which he was the head of the department. After his retirement from government service, he was the senior consultant neurosurgeon in Apollo Hospitals, Chennai. He has received various awards during the course of his career. The Shanti Swarup Bhatnagar Award, Standing Oration Award, Lifetime Achievement Awards in Neurosurgery for various years, for the sake of honor award, Param Acharya Award, Sri G.K. Subramania Iyer Award for Excellence. He has been the office bearer of various neurosurgical societies abroad as well as India. He was a life member of various neurosurgical societies in India and abroad. He was in the editorial board of various neurosurgical publications. He has published more than 150 scientific papers and he has presented more than 200 scientific papers in conferences. He was a pioneer in organizing the continuing medical education program in India. He was the first clinical scientist to start the CME program in India in 1977, and he had been the convener of CME program from Chennai. In fact, he has published the annual CME volume of the society from 1979 to 1984. He was an examiner for various universities in India and abroad, not only in the field of neurosurgery, but also in zoology, neurology, neuroradiology, neurochemistry, neuropharmacology, genetics, plastic surgery also. He was the past chairman of Faculty of Surgery here at DR Medical University, past member of the Senate, and past member of the Academic Senate of Sri Ramachandra Medical University. After his retirement, he was involved in social service, right? Not only after retirement, right from his student days. He was a secretary of the Madras Student Social Service League during his student years. He was the president of Swami Vivekananda's Medical Mission. He was later the chairman of the same, later the president of this. He was a member and office bearer of the Rotary Club of Madras. He was the general managing trustee of Sri Kanchikomapuri Shankaracharya Swamigal Trust from 1995 till his demise. He was a member of Sri Adi Sankara Research Center, chairman of Medical Advisory Committee, Sri Kanchikomapuri Sankara Hospital. Considering his commitment to teaching and clinical work, the Professor S. Kalyanaraman Oration was initiated in 2002 with a corpus amount of ₹40,000 donated by the Golden Jubilee Trust, Institute of Neurosurgery. The first Professor S.K.R. Oration was delivered by Professor Tyagarajan Subramanian from Madras on the topic cell line transfer in Parkinson's disease. Professor Kalyanaraman left us to the heavenly abode on the 5th of April 2026. He is survived by his wife, Mrs. Patamar, and his children, Dr. K. Subramanian, who is a neurosurgeon, and Dr. K. Anurada, who is a neurologist. Thank you.
Showing Mr. Sarvakumar sir speaking during Institute.
Before I could join the 5-year MCA course, and really agreed to take it.
Respected Dean, Kumar sir, VP ma'am, distinguished orator, honored guests, colleagues, and my dear postgraduates, it's both a privilege and pleasure to introduce today's SKR Oration orator, Professor Selvakumar, one of the senior most and most respected neurosurgeons of our country, whose contributions span clinical neurosurgery, medical education, academic leadership, and the pioneering development in the field of telemedicine. Sir has obtained his MBBS and MCH neurosurgery from the prestigious institution Madras Medical College, demonstrating an enduring commitment to lifelong learning. He later earned a Bachelor of Legal Sciences degree to better understand and address the growing medico-legal challenges encountered in our modern clinical practice. His professional journey began as an assistant professor in Madras Medical College, and he worked as an assistant professor in government service for 7 years. This early academic foundation laid the groundwork for an extraordinary career that has now spanned more than 4 decades. In 1987, he underwent an advanced training in neurosurgery at the world-renowned Mayo Clinic, Rochester, USA, and has continued to maintain academic and professional association with this great institution as a visiting consultant since 1993. A defining milestone in his career came in 1993 when he founded the Department of Neurosurgery at Sri Ramachandra University, Chennai. Through his vision, leadership and dedication, he built the department into one of the country's recognized centers for neurosurgical care, training and research. In 1998, he underwent a deputation in Department of Neurosurgery in Fujita Health University, Japan, under the legendary Professor Tetsuo Kano. During this period, he performed and assisted more than 600 neurosurgical procedures, gaining invaluable experience in the advanced neurosurgical techniques. Over a remarkable neurosurgical career, extending beyond 45 years, Sir has cared for thousands of patients with brain tumors and more spinal disorders also. He is also a founder member of Asian Congress of Neurological Surgeons, and he organized first live cadaveric neurosurgical workshop in 2004. He organized cadavers from USA for this one of its kind at that time. As a teacher and mentor, Sir's contributions have been equally extraordinary. For more than 5 decades, he has been involved in undergraduate, postgraduate and super specialty training. He has trained and mentored over 150 neurosurgeons, many of whom are now leaders in neurosurgery across the world. He has served as an examiner, thesis guide and PhD mentor for numerous academic institutions all over India and has contributed extensively to neurosurgical literature through publications and textbook chapters. Beyond neurosurgery, Sir is widely recognized as one of the pioneers in telemedicine in India. Working closely with ISRO for over a decade, he helped develop telemedicine network that expanded access to specialist care for rural population and underserved population. Under his leadership, more than 4,500 CMEs have been organized and telecasted. Over 12,000 rural patients were screened, and telemedicine initiatives have been reached through 53 African nations through Pan-African E-Network project. His leadership role have included Chairman of Telemedicine of Sri Ramachandra University, President of Telemedicine Society of Tamil Nadu and also the Telemedicine Society of India, Governing Council member and the syndicated member of the Tamil Nadu Dr. NGR Medical University and the membership of the Vice Chancellor Selection Committee. But Sir's distinguished service has earned numerous national and international honors. These include the prestigious Cushing Award from Chicago for his contribution to neurosurgery and telemedicine and the Best Doctor Award conferred by the Tamil Nadu Dr. NGR Medical University and presented by Governor of Tamil Nadu, and the Outstanding Citizen of India Award presented by the then President of India, Sri Pranab Mukherjee ji. This innovative Telerobo project for the neuro ICU was inaugurated by the late Dr. Abdul Kalam, reflecting his vision and integrating technology with patient care. We are honored to welcome a neurosurgeon, teacher, innovator, mentor and a visionary whose career exemplifies the ideals of Professor S. Kalyanaraman sir. Excellence in patient care, dedication to teaching, commitment to innovation and service to the society. Please join us in welcoming Professor Selva Kumar, Senior Consultant Neurosurgeon, Chairman of Telemedicine, Sri Ramachandra University, to deliver the Professor S. Kalyanaraman oration. Welcome, you.
Like specialty faculty members of various disciplines, family of Professor Kalyanaraman, committee of this esteemed oration, postgraduates, colleagues, friends, invitees, ladies and gentlemen. With profound honor, I stand before you today. With my special thanks to Madam Apuva Madam for being present in spite of her busy schedule, and my good friend Professor Dr. Vijay Prabhakar from Chicago, who joined me. In fact, and I told them not to join because they were so busy. He had just come for a few days, but he insisted in joining. and it's so nice of them to come here today. And I want friends, Dr. Rajiv, and many others who have joined me today on this prestigious day. As an alumnus of this prestigious institution, I feel the warmest sense of belonging to this returning here to deliver this important information. This importance is not only a privilege, but also deeply a personal journey with gratitude of reflection. I overcome with resonance, echoes, and nostalgia. These very halls remind me of my formative student days. This building, what you see today, is where we went through the whole education pattern of neurosurgery, which of course today morning I went and saw that got a better whole scenario has completely changed. The new building has come. But when I was an undergraduate, going through with many of my friends, I was told not even enter that area. This is what the warning was given to me, my friends. No, don't look at the building. That's not for us. But that was a frightening sense it gave us. All the 5 years I've never even entered the place, mind you, as an undergraduate. Or any of us probably. We were told not to look at the building, not to see the building. And that building was so powerful those days. They said, there's no way to see this building. So that was the history of this building, and today I come here to give my prayers to Professor Kalyanaraman on this important journey. My journey began under the mentorship of Professor Kalyanaraman, whose guidance shaped not only my career but my outlook on medicine itself. To return here now, the privilege of addressing the key leaders of today fills me with profound gratitude. The surgeries I performed, the emergency calls I handled, the friendship forged, colleagues who remain with us till today, while some of them are no more. The fundamentals of neurology remain unchanged. Yet the landscape of healthcare has undergone paradigm. With the advent of the advanced health tech, the perception of practice of medicine have expanded beyond the traditional boundaries. What was once confined to the operating theatre and what now extends into digital platforms, telemedicine, AI-driven diagnostic, reshaping how care is delivered and how knowledge is shared. We gather today to celebrate the life and legacy of Professor Kalyanaraman, a great towering figure in the annals of neurosurgery, whose journey began in 1934 amid the shadows of post-World War II. While the world was engulfed in turmoil, a quiet brilliance was taking shape, one that would illuminate the path of neuroscience for generations to come. Of course, the Professor Kalyanaraman psychiatric policy was earlier brief, and you see here, he has been a pioneer, and he has had his PhD from Edinburgh, and also his FRCS both from England and Edinburgh. He was among the earliest pioneers in stereotactic and microneurosurgery, and a renowned pioneer neurosurgeon of his time, standing alongside luminaries like Professor R. V. Yasser Bill, Professor Jacob Stanley, bringing the precision of innovation in the field was still in infancy. But beyond these remarkable achievements, Professor Kalyanaraman embodied something greater. The fusion of rigorous science, compassionate service, spiritual grounding. His life was not only merely about surgical precision, it was about healing and humanity, teaching with humility and serving with devotion. He stands in the beacon of reminder that medicine is not only a science, but also a sacred calling. His legacy inspires us to strive for excellence, to serve with compassion, remain grounded in values of transcendence. Ladies and gentlemen, as we honor Professor Kalyanaraman today, let us carry forward a vision where knowledge meets service, where innovation meets compassion, where science walks hand in hand with spirituality. spirituality. May his memory continue to guide us. May his life remain a shining example for generations to come. Recalling my formative days as a neurosurgeon from 1981, from 1981 to 1986, that's where I entered the Institute of Neurology as a special training. My association with Professor Kalyanaraman was a profound eye-opener. His training, guidance, spirituality, administrative wisdom, which shaped the course of my career as a neurosurgeon or what I am today. Every day was a learning curve, nothing short of transformative alongside me. I had the privilege of learning from other scholars like Professor Narendran, Professor Jagannath, and many others. I vow to earnest to these pioneers who illuminated my path towards the distinct career of my neurosurgery. The dark phase of my neurosurgery is something which I want to talk about today. I have been keeping this in mind for a very long time. I have not exposed this to any of my family members, but this has been very deep of what I am going to say today. My oration would remain incomplete if I do not share my nostalgic yet challenging experience during what I call dark phase neuroscience. In those days, the Institute of Neurology, without CTMRI itself, was often a part of making a diagnosis. It was daunting that encouragement of stalwarts like Professor Kalyanaraman gave me courage to continue. I joined the Institute as special training for 1 year, just to have the pinch of you seeing what is neurosurgery, so that I could join the 5-year course. My first posting was with Professor Kalyanaraman Neurosurgery for the first 6 months. Was a turning point. I learned discipline, punctuality, administration, and how to handle critical neurosurgical emergencies and calmness and composure before, during, after surgery. One incident which I wanted to say here is very touching. I discussed this with many people whether I should talk about it here or not, but many of them said not this, but I felt this is the only occasion I am getting old, I should say this. The 1983 incident, which completely jolted me in my life, till today probably. I must share the incident that a 10-year-old child with severe intracranial pressure was brought for a CT scan to the ward. It was a mandatory for a neurosurgeon at that time, or PT to be posted neurosurgery, from the neurosurgery inside the CT scan. So that was the beginning of CT scan, and one of the postgraduates was posted, and I was one among them. This child was very, very restless, but a diagnosis was made as a brainstem lesion, so a scan was ordered. IV contrast was given to the child, and the child became more restless. So, there were so many waiting people for scans, and the pressure was so high. They said, child was restless, take back the child to the ward, or give some sedation. I probably shouldn't have done it, but I gave the child IV contrast. The scan was over, the scan was finished. And then the technician called me, I was almost there, said, child not responding to any cause, please rush. So I rushed to the child was in the gantry, found the child was not responding, not breathing, and so immediately the situation I called Dr. Kumar was in the duty room, and rushed, and everyone took the child to the nearby ICU, the neurosurgery. I did the ward. Did all the resuscitation we could do, but was effortless. So I did not know what to do, and then I had to rush to Professor Kalyanaraman's room and then explain to him what exactly happened. I said, the first word was, I said, it was the same typical word, I still remember, we lost the child. He said, go and search for the child. So I thought, no sir, no more. In fact, a few seconds he was also shaken up, and then he asked me what happened. I said, I explained to him the details what exactly took place. He said, you made a diagnosis for brain stimulation, child was restless. What was the scan finding? That was the first question. I said, the scan was normal. There was no lesion, nothing except for white matter. The scan was normal. He said, what was the reason for giving the value normal? Sedation, knowing his brain stimulation. I did not have an answer to that. And that was completely shaken me, and from since that time, I never touched giving injection to anyone in my life. I have not got over that still, because he said, we don't know what happened. Contrast was the issue, IV compound was the issue, what we don't know. That did not wake up. I have seen several deaths in neurosurgery, I have not seen today. But this coincidence, at that time, completely shaken me up, and I could not even come up, not thinking about the child. So that was a bad incident which happened in my life there. Of course, several deaths we have seen after that. But this was a bad incident, not forget. Since then, I left the institute and ran away. I did not return to the next 5 days. Till I get a call from AMSA saying that Professor Kalyanaraman wants to come, asking me to come and meet him. So I met him after 5 days, just looked at me and said, just go to this floor, the child pediatric ward, and you will work only in that ward till you leave my body. So I could not even question him back saying that. And he said, that's what that is, you go and learn there. And since then, there was no turning point. The confidence installed by him is gentle yet firm tone. Don't panic, learn from your mistake, don't repeat mistake ever again. Became a cornerstone of my resilience. Legacy taught me countless other under his guidance to pursue the excellence of neurosurgery while remaining confident in me. Today I stand before you to carry forward the lessons of those years, discipline, humility, resistance, above all humanity. That's one of the reasons of my talk today, because I wanted to talk something differently on the spine. Professor Kalyanaraman likes it. That's the topic I wanted to talk today. Learn so much from him about spine work. But this particular area of no monitoring those days, which was always in my mind, which went too deep, and that's probably one of the things that I wanted to talk on monitoring, how to be helpful for patients to come, because in the ICU and other places we have a good monitoring system. But when the patient comes back to the ward, we get sudden blue code and not saying that the patient suddenly collapsed. And then there's no monitoring system in most of the wards, either in the government hospital or in the private sector. We do not have a good monitoring system. And as Professor you see his publications of patient delivered more than 20 lectures and guided PhDs. Let's go back to my talk today. Because each slide is one topic. Sorry, not driving. We need to stop at some point. I keep on talking. It's my passion. I keep on talking. So, the topic is Care Beyond Hospital to Digital Health today. Something which is very important to me. As a neurosurgeon, telehealthcare advantages for more than 4 decades, and as a lawyer, I have witnessed technological breakthrough at different junctures. The chosen topic is the need of the hour, especially for the young postgraduates who are here, to understand the evolution, present, and future of digital health. Early healthcare beyond hospital walls relied mainly on doctors, nurses, paramedics, assisting homes treating patients acute illness, hospitalization for chronic disease. The follow-ups were physical message back to the doctor in person or dial-up phone. That was only available. No mobile, no WhatsApp, no video calls. 3 decades ago, telehealth was virtually unknown, a black hole in our academic journey. Dedicated missionaries, medically qualified technocrats, ISRO scientists, united the concept of health, laying foundation of telemedicine. This evolved into a refined healthcare system extending both tele-education and tele-services across the world. These are some of the visionaries who were at 3 decades back. You see Professor Telemedicine, who was introduced earlier also. He was the director of Health University, a pioneer both in neurosurgery. In fact, he was the founder president of the Asian Congress of Neurosurgery, where in 10 years he had trained about 100 neurosurgeons, free of cost, taking them from different parts of the world, especially the Asian countries, India, Pakistan, and other places. I was one among them, earlier trained by him. 100 neurosurgeons taking from their own place, making them stay for about 7 days, giving them hotel stay, flight charges, and then train. Many of us in India are all trained in such a way by him. And he was one of the pioneers in letters in starting the telemedicine program, which I will come back to. Really funny because again a neurosurgeon who started this telework along with me, who was Amrita at that time. Dr. Langan, most of you know, is the chairman of ISRO, who is also an MP later, who has supported the growth of telemedicine in the parliament. Dr. Ganpati, of course, most of you know, a great neurosurgeon, a visionary in telehealth, who was an Apollo, who started the Apollo Telehealth Center. In fact, when I told him I'm going for oration, he said, tell Dr. why he did not call me, call you. I said, probably because that's what Dr. Kalyanaraman wanted, not me, or Dr. Rajiv. He said, I have been working with Dr. Kalyanaraman so many years, and I did not have the opportunity. How did you have this opportunity? So that's what we had a small lunch a few days back, what we were for you, Dr. Rajiv. And of course, Prime Minister of India's vision at the time, Vajpayee was a great leader whose vision was so big that I will come back on that area on my slide there. He was one of the eye-openers for that. Well, it was in 2024 March, Bill Clinton from US, the president of Bill Clinton, who come to India to inaugurate the first telehealth program in Apollo, Aragon, a small village in Aragonda, in Apollo hospital had a small clinic. He had come to inaugurate. At that time, I don't know what was telemedicine. I did not know about it also. He came and inaugurated the telemedicine program at that time, and it was ISRO's pilot project. And then there was no turning point from 2001 to 2000. What we are today. It's a long journey we are passing. That's this slide. The first Asian neurosurgical conference between 4 countries, where Japan, Singapore, India, and Hong Kong was the first neurosurgical conference to be organized by me and Mount Chennai. Professor Kanu called me one fine morning and said, in February 2001, saying that we will have telemedicine conference, live conference connecting 4 countries. Like a fool, I said, okay, and get support. I thought it was like some telephonic conversation we are going to have. I never knew what was telemedicine at the time. I said, okay, sir, I get support. I get a mail from him saying that these are all the equipment required for telemedicine. I was shocked. He said, a 10 lakh worth of a camera is required for telemedicine. He said, ISDN line 4, I never knew what was ISDN. What one ISDN line was present that time in Amsterdam? He said, 4 ISDN lines required. I said, we don't have all this. I ran to my chairman, President Chancellor, Roy Megadasha. I told him, sir, of course, he knows Professor Kanu because he had treated Kanu, treated here of India, and there's a very good bonding, and he had met him several times. So I told him, Professor Kanu wants very conference to be done between 4 countries. Go and do it. Coolly, I said, sir, that's not possible. Why? He said he wants 10 lakh worth of camera, which is not available in India at that time, polycam camera. And he wants 4 ISD lights come into the Ramchandra to do this dial-up connectivity because that time there was no internet. To connect, I said, all that is not for television. So I did not know, panically, I waited for one day, next day, my chairman, and calls me and says, I ordered the polycam camera in Hong Kong, someone will carry it for you. You go and do the hardware. I was shocked. Then I said, what about this ISP? He just took up the phone, called the BSN chairman, and he said, sir, this is a very important conference we want. We want 3 lines for ISP line to be brought. We do not have. Mind you, within a week, we got the 4 ISDN line, we got the camera, thank you, equipment, our technical work, and we conducted the first Pan-Asian conference in the year 2001. That was the beginning of telemedicine in our Canada. So, I wouldn't know what it is. It was shocking, and thanks to our missionary people. Though the support of the, wherever you're working, with the support of the people that you're working with. They are the people who support it. And then the conference went on, and that's not the speech. The conference day came, everyone was there, all was packed about faculty, people, faculty. First time we are hearing about 10%. All was packed. At about 11 a.m., conference started. Electricity went down. 2 hours, mind you, the conference, there was no electricity. 50% of the faculty walked out and said, no, numbers, no game. Then, after 2 hours, electricity came, and then Professor Khan waited for us to have the conference. He conducted the conference, and that was an eye-opener for tele-education programs. I'm grateful to this great gentleman for what we are intelligent in India. And of course, as I told you, at the same time, Apollo was also growing with several of the programs recently coming to Apollo, inaugurating Diamond project. And then there was no turning back at all on the telehealth in the country. In India, Chennai was we were the people who started the program of telehealth. Then it all split different places, and then there was no turning point at all, because that was the time the first satellite connectivity was given by ISRO, and first satellite went, and then it was completely given for telehealth program of the country. And then came one of the important programs where we had to collect this telemedicine program from Ramchandra to different villages for tele-education of the people that Manmohan Singh and the Prime Minister came and inaugurated this program. And then this was, all the villages were covered, and till about 10 years back, we were able to do, of course, now things have changed to different aspects. Till 10 years, till about 4-5 years back, this program was a very active session with, we combined this with the Dr. Swaminathan's programs, and then that was a big success for us. Connecting to different villages of Ramnapuram and this was the pioneer first telemedicine program which we had, where Atul Bhai in 2002 inaugurated. Yeah, this was not history, and not just telling you, this is because history is very important here. Without history, nothing can be known. So these are all history which is known for graduation. How we grew. So it was Atul Bhai in 2002 who inaugurated a telemedicine link between Chennai, Ramchandra Hospital, and GP Fund Hospital and Andaman Nicobar. Andaman Nicobar is all that. They have 450 bed hospitals, but that did not have any specialty services. They had basic services, but that was the first time where we linked through the telemedicine, where we gave all specialty services to this particular area, this particular hospital, because the specialty services required for them are based, because 90% of the Andaman had government officials, and the government had to take care of them, otherwise they need to be taken off from the island and brought to the main island. So this was a very important opening, as a pioneer of telemedicine, I'm very happy that today, till today, this service is going on between Chennai and Hospital. This was a visionary. When I joined the Ramchandra Hospital in 1993, he is the person who gave me just a plain check. Said, when I came back from Japan, I could not fit into any of the government institutions. I was working in the government institution here. But I wanted to do something a little better, so I asked for some posting here. That's the time he gave me a blank check and said, you start the department of medicine. So that was a big vision I had, Mr. Udaya. I said, sir, I'm still working in government. It takes a long time for me to get into. What relief! I spoke to him the morning, next day morning my orders were got me. And I got relief the next day. So that was the power he had. And then I said, I'll come and join on a good day. He said, you don't decide. I decide what is a good day for you. He said, today is a good day for you. Just join. So that is the type of vision these people have. See? I did not even look back. I government service, next day I got relieved, and then the same day I get joined with government. That's the type of visionary. So 33 years have passed, the same institution today. So a lot of work is still going on. And this is the Pan-African E-Network project. You see, this is something building for a country, sponsored by the Ministry of External Affairs Government of India, where Dr. Abdul Kalam went as the president to the Union of Africa. He spoke on the Union of 53 countries and promised them that India will give you tele-education and tele-health services to the 53 countries. And 11 institutions were selected for this purpose. And Ramchandra was one among them in this 11 institutions. And we gave, we had, that was the time, he insisted, he came and inaugurated this important program, the Pan-African E-Network for 53 countries, where several CET programs were given to a private agencies in Delhi, and then these 11 agencies were giving support to 53 countries in Africa. That went on for about 9 years to the next government came. Then that was the big beginning for the Pan-African Neurosurgery Conference. And we did about 1,200 CME programs, several of the 10 countries. And during that time, many people joined us for PhD program. We had about 3 PhDs for telemedicine completed through telemedicine from Ramchandra. And Dr. Abdul Kalam was one of the guys that was able to go back to one of the students for this tele program. Tele-education at Ramchandra, we keep on doing till date. Because of being a university, there are several programs goes on every day in every department. So we were easily able to connect to various institutions within India, to many institutions across India and abroad. And MOU with Japan, Russia, and several other universities where we had CME programs connected. We had about 4,500 CMEs connected till date, which is highest in the country. And grand round live workshops, conferences, training camps, tele-dentistry, several of the programs are all taken up through this tele-education program going on in a big way. And institutions like Apollo, Arvind also, there are all other institutions are also doing the same work. I'm very thankful to them. They also get connected. James is one of the institutions connected to us in a regular way. Tele-consultations in Ramchandra may be very less. We have done about 40,000 consultations because we have a set pattern of libraries, not like other institutions or other universities, where our consultation service will be between doctor to doctor only. Of course, the patient will be there, but we do not talk to any patient directly because of legal issues. We are very clear about it. But other hospitals today, they do round the clock and every patient. The Ramchandra does not do that. We are very clear that the consultation service is doctor to doctor with the patient. And we have done about 40,000, and we do regularly with the many for including maybe so many northeast areas. We have our own centers in northeast. So we get connected to all these clinics every day. Our doctors go there. They come back all the calls that are consultation services. As far as the mobile network is again a big area where we have done several important programs through this particular grant which is being given by ISRO. And you see the satellite, big satellite support. Now because we had a lot of problems, the satellite when they go to the village, they had a lot of problems with the trees coming in the way. So nowadays the whole modification has been done by ISRO, but a lot of work has been done with this telemedicine program. The newborn screening, when a child was born, this man goes to a village about nearly 150 kilometers away from our hospital on a daily weekly twice. Then these newborn children are screened when they're born because they find it difficult to reach our hospital. So they are not too sure the child is here or something. So a lot of work has been done. One of the PhD pieces was done by Dr. Vidya through the mobile telemedicine plan, where audiology testing was done. It was transferred to our hospital. And if they find anything positive, they will be referred to the hospital. And this is again almost a moving circle, bus or hospital created by 5G technology in Lucknow, School of Telemedicine. This is what we call School of Telemedicine in Lucknow. The government of India has given 100 crores for this particular building where you go there and see this to believe the technology is available that they can't offer. And they are the pioneers of the pioneers today in telemedicine. And 100 crores from expansion. And a lot of work is being done. And they have so much of technology and they have so much of faculties of telemedicine also. 2000 to 2035 our vision, different types of course, code as I opened the telemedicine. A lot of these digital buses are available, including since I've got these types of buses, but 5G and they keep moving to different villages, and ISRO vans are available, satellite connectivities. And this will be the future of reaching all the villages. We have about 6.5 lakhs of villages. The future will be this again, where robots will play a very important role in monitoring the ICU coming days. We had this mission, but there is some failure now. We used to use in the ICU on Chennai. This robot used to go about, stand there in front of the patients for 24 hours, 48 hours, any number of hours. Nurses cannot do that. And then we can directly talk to the patient, and they closely monitor these robots, keep monitoring, including the fluid mechanism and all this. And this was an eye-opener for our ICU. And this, of course, today in Japan and several other countries, robots play a very important role in the ICU management. And of course, they are used to carry like other pharmacies in most of the hospitals today. But we had this inaugurated in 2013 in our hospital. The primary health centers in Tamil Nadu are our backbone. As I told you, 140 crores of patients, people around in India, 6.5 lakh villages, 70% of our population is villages, 70%. And this is a big area which is not being covered. We look into our main city, 3-tier and district hospitals. But don't forget, 70% of the population are still in villages. We need to look very deeply, and we have the PHCs, about 2,127 and 50 to be added. Only 23% of these primary health centers are connected to digital health. We need to connect more. These are the areas which we have to do in the coming years. And as we have given several proposals to the government, but to say now it's only about 25% of them, either for maternal health or disease treatment. This is going to be the ultimate, and we need this to be. The community health centers are very different from the primary health centers. The community health centers are better than primary health. They are about 483. They have some good services of digital centers, and these centers are about 40 beds. And of course, they have primary health centers have got issues. They will be changed to community health centers. And of course, they cannot be handled with the transfer of the district hospital. But the community health centers are not many in districts, but we have to look, but that's where the wellness clinic will be looked into, and we need to have these 4 openings in coming. The referral flow chart you see I've drawn for you, the primary health, that's where the first screening will take place, and transfer to the district hospital and pre-time. Basic consultations are still available, but no doctors sometimes. The IRs are these people, they do a lot of telework. They screen the patient, inform the district hospital about their problem or any emergency prior, inform the district hospital. And medications are given, but of course, if they are not able to take up these things, they are transferred to either to district hospital or to the private hospital. Now, Tamil Nadu, as it stands, much better compared to any other state. But when it comes to states which are very close by, Karnataka and Maharashtra, that's where the fight is. We are very close. We are very close. And you see these primary health centers, 45 is to 1 district hospital. Whereas in Karnataka, 30 is to 1, and Maharashtra, 28 to 1. So we are much better in coverage, but still a lot of areas have to be taken up for district health. And that means connecting rural clinics with urban clinics. And it's Karnataka, I think if we are going to close our eyes, Karnataka will overtake us. The digital health revolution in India is nothing but short but the telemedicine society we have today, where about 1,400 members are actively involved in the society. The doctors or the scientists or technicians, they're all covered. They take up in a very big way remote consultation, they help us in remote consultation, television program, rural housing, or telemarketing. I will come back to earlier. But telemedicine society has gone in a very big way in helping the growth of digital health in revolution in India. What are the telehealth adaptation? That's more important. How telehealth adaptation and what are the factors in India which helps the growth of digital health? Of course, today the 4G or 5G network is available in places and smartphone. There will be no 21st century. There will not be any stethoscope I see because smartphone will be the future, and there will be a smartphone will be the stethoscope. And present and penetration will be very high in smartphone. Of course, e-Sanjeevani and I1 have been doing extremely good work in this adaptation where telehealth growing up because of e-Sanjeevani come in 2019. This we are not able to solve, I don't know. We are able to solve many things. Connectivity, electricity, and other things. And this is going to change. We will not be able to move forward. It's all happening. So, secondly, the adoption, telehealth factors that I told you will be, these are all factors. COVID-19 has completely changed the digital world. You know, there's no health services practically during COVID. Of course, people are all well off during that time. No one reported much of any heart attack. A stroke was not seen much during this COVID time. See, we don't know why all that happened, but COVID is open eye for telehealth, and we had a lot of these COVID patients that monitored through the war rooms, which was open by Tamil Nadu government. Most of the telehealth is going on. These are all factors which help the growth of the telehealth, and of course, cost and convenience. These surgery programs are all one of the adaptations for the factors to growth of telehealth. Of course, they are all enablers, barriers, and accelerators, and I will probably say more factors will come as we go forward. And of course, despite this progress, digital literacy, internet connectivity, and cultural access continue to be one of the major factors and challenges which we are facing. Now, the medical specialties are comparatively higher compared to surgical specialties. It's a known factor. Of course, non-surgical specialties hold about 68% when we want to the rate which we are doing telehealth services, what we are doing as consultation services or anything, psychiatry, cardiology, neurology, they are all much better when percentage is quite good. The number of cases what you rate is much better. Smart homes, as I told you, will be the future. Most of the telemedicine centers are getting closed. Fixed centers. They said this big hall is not necessary. Smart homes will do the same work of what hall is doing. Everything is getting into smart. And today, most of the villages, they say, 40% of the villages are covered by smart homes. Villages carry smart homes. Of course, the only problem is the connectivity. The connectivity is good. In about next, if we are looking, the city will be getting 6G. I'm sure 4G will go into the villages. And this will be a big eye opener in coming days, including for education. Many of us today don't even sit in front of the laptop and everything. As we drive, we see and we talk. All these things will be in smartphone. Specialty service will not be able to reach all the districts. This will be one way to take back of giving services of major surgeries to districts, and then compare this matrix with Japan, because Japan has already moved very high, and most of the surgical work are being done by the Of course, Ayushman Bharat and NHS framework go together almost nowadays. That will be a big work in coming days, especially in telesurgery. Telementoring is very close to my heart. Telementoring is very close. Here you see this slide. We have saved from Ramchandra leading life. As I told you, GP Hospital does not have super specialty neurosurgical services. Of course, now until one surgeon comes to do some work and go, but they do not have cardiac thoracic surgery. Even though they have basic MS general surgeons who can take them and do some primary neurosurgical work. But those days, they were afraid to do stuff. You see, as I told you, the 90% of the employees of the people of Andaman are government employees. And if there is any head injury or anything, these people have to be airlifted, which costs the government one airlift about 18 to 20 lakhs. And it costs the service to reach the main town, either Chennai or Kalyanaraman. So that was becoming a big expense for them. And now, after this tele-link, only patients who require emergency surgery are there. And some patients cannot be airlifted because they are already in bad condition, but they are on ventilator, cannot be moved. Here, through telementoring, we have saved 18 lives. For example, we told them after doing the CT scan, scans are sent to us, monitor the scan, and then we tell them a simple bulb would relieve an extra or shunt procedure. They're all trained, they're all emergency surgeons who are trained to do some basic works. So we told them how to proceed with markings that they have done, and for nearly 9 years we have saved about 18 days. That's something big for me, and it worked very good. And we continue to do mentoring. And today, telementoring has been one of the important areas in many hospitals, especially where they are not able to get super specialty services, and then get able to get the services done through telementoring. And today, you see this, we are connected to the UK doctor performs the remote surgery connected for prostate surgery. We connected to 4,500 kilometers from Madras in UK, and he is able to do a prostate surgery here and monitoring, and he has completed that full prostate surgery. And that will be the future. That's going to be the future in coming days. And telesurgery, which is, will be a bridging distance, saving lives and compound in surgical care in coming days. Drones in telehealthcare is a big area, because this is just a big topic and we can talk for hours. And drones, which are used nowadays for various purposes, the armed forces, agriculture, and for several other purposes. But in health, from 2019 up to COVID, drones have been serving in a very big way in carrying, especially in places like Nagaland, hilly areas. These drones are being used to carry the vaccines that delivery system to areas where stores provided these guys along drone services to many areas, city areas where they cannot be reached. Drones are being used, and in 2027, swarm drones will be used to connect 5G where in emergency, where major disaster takes place, drones will be out there. And of course, in coming years, the organ transplant and other things will also be done by drones that will be a digital format connecting, and you will be able to monitor them very closely. And drones, if they can, will be in the sky in 2027. Because you see, drone telepractice equipped with cameras and microphones will be having teleconsultation directly from villages, especially villages where they are not able to reach, and also disaster help will be through drones. This is an important slide where we see telehealth is being used in aerospace. Aerospace is one area. Aerospace medicine is becoming essential for most of the aeronauts that are going to space today have to be monitored very closely. And we have a good monitoring system. For a millisecond, there is going to be some where the transmission may take place. They come back to 0.2 milliseconds today. NASA has created such a way that 0.2 milliseconds will be the only delay time where you monitor and all real time the space astronauts. Of course, so Kalyanaraman Oration, which is also where in Bangalore they are very closely monitoring this telemedicine activity, where I'm sure you will be sending people to skies, and they have to be monitored very closely. In Bangalore, they have a very good center where the Institute of Aerospace is closely monitoring for this particular purpose. And of course, you have these medical avatars where you create an avatar and closely monitor like a real patient down to the earth. And that will give us a lot of information on it. Again, telehealth has played a very important role in suffering workers, especially people working in underneath. They have to be monitored very closely because these people again, like these people when they have body, when they are to be again taken from either from their place to the hospital, it's very expensive. Especially in some areas, they have to come up and it's not quite expensive. Today, in all the surroundings, most of them will have the telehealth program where closely people are being monitored. So a lot of pressure changes take place and they have a lot of illness, and telehealth program for them are being quite helpful. And also in the ships will have 20 kilometers internet start for internet will not stop. These people have to be monitored. And most of these costly ships have issues on health aspects, and they are again closely monitored through telehealth. Defense is one area again very close, and they are very closely monitored through telehealth. And these wearables which they wear are completely there. They're all sensors, and most of the sensors keep on giving us a lot of information, and they are very, very closely monitored through satellite enabled. And most of these today, Leh and other areas, Himalayas and other areas where these soldiers are posted, 40 areas or military areas are regularly monitored from the Pune or from Bangalore, are very closely monitored on health aspects, because these people fall ill very soon, and they have issues pertaining to oxygen and other things. Doctors who keep on monitoring them from these areas, give them advice what to do, or they are realistic if they are not able to be monitored. Hotel industry is another area which we are coming across today. Most of the big hotels, they have this teleconsultation services available, especially if they are small islands where they want to go and spend a lot of time in Mauritius, Seychelles, and other areas. These areas all have telehealth medicine programs, and even our hospital. Today, you see, the hotel industry is very big. 1.5 lakhs are registered hotels in our country, and for 70,000 registered hospitals. So 1:9 and 1:20. Hospitals are 1:20 ratio. The hotel industry is about 1.9. Where people don't stay in hotel. So these people have to be monitored very closely when they are staying. A lot of issues, health grounds, and most of the hotels where fundus screening plays a very important role for getting of us. What we are seeing is electropathy and then big institutions such as the hospital do back for consultation every month, giving this patient for retinopathy for that. But the most important tool what we see is AI related tools, where a lot of work is being done, where you detect through this AI tool, through the fundoscopy, several diseases can be made diagnosed, including Alzheimer's, many diseases, cardiology, and oncology is very many. And there is a French hospital, and where they are going to have a movie with them, where they will make diagnosis, see through the fundus. 18 diagnoses can be made just by seeing the fundus, taking for these. And this is going to be a big eye opener. They are ready, they can be given to district and village. This will be a big eye opener where we will be able to make an early diagnosis for this patient. And this will pave way so that in coming days, early detection will be a very important area where urology or cardiology is making a big difference, especially in cardiology and urology. If some diagnosis can be done earlier, this will be a great help. Technology does not replace issues, in my view. It removes obstacles so they can practice at the top of their license. AI will not replace doctors, but doctors who use AI will replace those who don't. This will be definite. The second phrase is very, very important. AI will not replace doctors, but doctors who use AI will replace those who don't. So I think we should get into this practice of AI very soon. And this particular slide is very, very important. And in 2017, where Telehealth program and Dr. Jayakabha organized a major conference under the president Turkey, he inaugurated a very psychiatric program where many psychiatrists from India participated. And telepsychiatry was one of the eye-openers at that time. And today, after that, several important programs are taking place in this telepsychiatry, especially in India, alcohol and telepsychiatry, they are very important, are very important areas. And Himan's hospital has played a very important role, where at least 400 villages are connected every day. And in a week, that is 40 centers. And these stations are all controlled to take place on a weekly basis. They are being followed up. The patients do not come due to various reasons. They do not come to the hospital. They're all being using smartphones that given to them. They're all followed through for this purpose of alcoholism or drug abuse. Suicide is a very big problem, and we need to somehow address this issue using this technology. I'm not going into this aspect because this is again a big area, medical legal aspect. I'm happy to say today, as such, in India, we do not have one single medical legal case against them. So we are lucky. We would still like to continue this, but this medical legal cases issues will be dealt on digital matters, especially on remote injury documentation. Today, in Chandigarh, PGI Chandigarh, they use this telehealth programs for all the patients who are there. They are not taken to the court or anywhere, but they are taken and given opinions only for the day using the digital health program, and even for documentation is all acceptable through telehealth program. As I tell you, as a president of telemedicine, I have taken the digital as a digital, the mother, naturally twins like telemedicine and telehealth together, and under my leadership, guidance from my colleagues, CSA transforms the technology-driven society to healthcare impact organization, aligning telemedicine with India's border mission leadership bridge the gap between policy, practice, and innovation. Of course, today we have several monitors available in the market. These are all very smart gadgets which are available devices like remote monitoring devices. Very cheap. These are all monitors which are available like watches and digital stethoscope and several others. But this one, which is available in the market today, is a small sensor where it is put on the chest, where five monitoring systems can be done. Continuous BP monitoring, your ECG, your saturation, your pulse monitoring, and two other monitorings can be done, and you can monitor 3 seconds continuously 24 hours after surgery or taking wonderful cardiac surgery, anything. A continuous monitoring, you only need to change that particular what you put the patch that has to change once in 7 days. You can get it for 51 rupees. And this monitoring system will be available in the market, and this will go a big way, especially in patients who are in the wards, you can give them if the government agrees. And this monitoring can be done on a central monitoring system where you completely monitor 24/7. This will be the future. You will be getting monitoring completely in your smartphone, or all the algorithms will be completely monitored. If there's any change, like a pulse becoming, you can just put them normal as a patient of 70%. You can take the patient gets down to 50, it will give you a beep or alarm, and you can alert it. So this will be available in the market, it's already there, and this is already available in many places in Bangalore. The growth of marketing as is projecting, see, 23 or 28 billion. We are projecting in 2030 450 billion. This is where the market is going to go right on these gadgets available. And startups are already doing such a good work with hackathons and many other things. This growth will cannot stop this growth of of course, skip this for time being, and we have started the online health telemedicine course in Dr. University. Me being the last, as being the governing council as well as the Senate member, even being there itself, I had so much of difficulty in starting the digital course, and this is active now from last January. We started this course. It's mandatory from India that all the doctors have to go to the digital formulation guidelines, have to be learned. They will be given certificate, and this is mandatory. It will be made very soon mandatory. I mean, it is okay now, but this will be mandatory. Like you cannot practice telemedicine without the guidelines, and these guidelines, this course will give a lot of information. It is 2 months course, very cheap, and then I wish that you know to take a course in coming days. This is my last slide. I want the Madras Medical College to be a center of excellence. I don't know how this is going to happen. Raghavendra, this is for you. Take up. See, there are centers of excellence available for so many things. MNC has to be center of excellence for digital health. We can get sponsors anywhere, that's not an issue. A small place, center of excellence has to be done for digital health programs in communities. Simulators can be kept, skill labs can be done. All these things, so much of data is available. I don't think any other institution can do except MNC. So, a center of excellence for digital health has to come in coming days. Only to you people who are working here. Of course, we are going to do our representations to the government. Those which, as I told you earlier, 100 crores were spent on the telemedicine, school of telemedicine. Why can't we have a school of telemedicine? Why can't we have a center of excellence? After all, it's going to be 50 crores, 100 crores, nothing is wrong. We should plan in coming days to have a center of excellence. I wish that this idea will go into people, and then we will take up this in a very big way, and then give our representation to the government also in coming days. And this should be done at a very before someone else. Of course, I read this slide, Professor Kalyanaraman legacy on final neurosurgery display. many of whom now serve across the world, carry forward the time to be an historic biology and the new frontiers of this health. I, to my sister, and this team, body invite me to deliver the earnest request to present faculty to embrace the digital health, adopt policy-driven AI technology. This institution will become an enabler in a modern and replace across all specialties in healthcare design. The postgraduates and faculty urge you to work together as a team to honor the legacy of our mentors and to move forward boldly towards aggressive adoption of digital health. This is not merely the future of the space itself, medical practice. Medicine is not just a profession, it's a continuum. From my mentor to me, and from me to you, thought is past, may you carry forward courage, wisdom, compassion, and humility. May the journey be innovative. Thank you very much.
Thank you, sir.
Directors of Institute of Neurosurgery and distinguished orator, Dr. Kalyanaraman Oration, and esteemed faculty members. And it is a proud privilege for me to propose the vote of thanks on this memorable occasion of Professor Kalyanaraman Oration on behalf of Institute of Neurosurgery Excellence, and we pay a respectful tribute to the legendary Professor S. Kalyanaraman, whose extraordinary contribution to neurosurgery, medical education and research continue to inspire the younger generation of the neurosurgeons. This oration is a fitting tribute to his remarkable legacy. And our sincere appreciation and thanks to orator of this day, Dr. K. Selvam sir, for delivering the outstanding and the thought-provoking oration on care beyond hospital walls through telehealth. It is a pioneering. He has given the short tally on the experience in the pioneering work in the telemedicine. He has enlightened us regarding how we can bridge the gap between the needy rural population and the specialist. I thank you one and all for your gracious presence and the valuable support. Thank you, sir.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष माहे आहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
huge thanks to everyone who tunes in to Dr. VGP's podcast. We've received the YouTube Silver Play button for reaching 100,000 subscribers and counting. We sincerely thank you for being part of this wonderful journey with us. Click on the subscribe button and hit the bell icon to notify you with all our future podcast contents. Thank you again.
Dear viewers, elevate your business to new heights and reach 35 million potential customers with Global Eye Digital. Contact us today at globaleyedigital@gmail.com or info@globaleyedigital.com. Let's take your business global.
Welcome to the future of medical science. At Soft Landing Labs, we go beyond the basics of drug confirmation and quantification. Using advanced LC-MS/MS technology and our own proprietary software, we deliver accurate, fast, and meaningful results. We're the only lab offering color-coded reports and a web platform with medication tracking and drug trail interpretation. Our personable professionals, ethical practices, and 24-hour stat testing mean you're never left waiting. From doctor shopping alerts to provider video support, we've thought of everything to help you stay compliant and informed. Soft Landing Labs. Accuracy, innovation, care. Soft Landing Labs, your trusted partner for drug-free communities.
Fusion Systems and Services, a powerhouse in innovation, delivering transformative technology solutions. With our groundbreaking cloud-ready product, ITIS, leading the industry as the ultimate RPA solution, trusted by top global enterprises. From mobile application testing to middleware automation, from big data integration to SAP automation, and even Salesforce automation, Fusion Systems is your strategic partner for success. No challenge is too big. No system is too complex. Empower your business with Fusion Systems. Visit us now at fusionsystems.inc.com and revolutionize your future.